The doors of the emergency room burst open with a force that rattled the glass panels, and 4 men in torn tactical gear stormed in, carrying a 5th man between them. His leg bent at an angle that made 2 passing interns stop and stare. Blood soaked through a makeshift bandage wrapped around his thigh, and his face had gone pale from the pain he was fighting to hide. "We need a doctor now," shouted the tallest of the 4, a broad-shouldered man named Derek Coleman, his voice cutting through the quiet hum of the small hospital like a siren. His eyes were sharp, used to giving orders and having them followed without question. A petite woman in blue scrubs stepped forward immediately, her steps calm and measured despite the chaos around her. Her name tag read Laura Bennett, and she could not have been more than 5'4", her hair pulled back in a simple ponytail, her expression unreadable. "Lay him on the bed right here," she said, pointing to an empty stretcher near the trauma bay, her voice steady and clear. Derek looked at her for half a second, his jaw tightening. "We need someone who actually knows what they are doing. This is not some sprained ankle." Laura did not flinch. She reached for a pair of gloves and snapped them on with practiced speed. "Then you are in the right place. Lay him down." The 4 men exchanged a quick glance, clearly unimpressed by the small woman standing in front of them, but with no other option, and their teammate groaning in pain, they carried him onto the stretcher. The injured man, whose name was Ethan Miller, gritted his teeth as they set him down, sweat beading on his forehead. Laura moved quickly, cutting away the makeshift bandage with surgical scissors, her fingers steady even as blood welled up from the wound beneath. She pressed gauze against it with firm, practiced pressure, her eyes scanning his vitals on the monitor that a technician had just wheeled over. "Pulse is elevated, blood pressure dropping," she said, more to herself than anyone else, though her voice carried the calm authority of someone who had done this 1,000 times before. One of the other men, younger, with short-cropped hair and restless eyes, folded his arms and watched her with open skepticism. His name was Tyler Brooks. "You sure you can handle this? He needs real medical attention, not just someone slapping gauze on him." Laura did not look up. "I have handled worse than this in far worse places than a hospital hallway. Give me room to work." Something about the way she said it made Derek pause for a fraction of a second, though he quickly dismissed it as coincidence. He had commanded men through situations most people could not imagine, and he was not about to be lectured by a woman half his size in a quiet small-town hospital. "Where is the actual doctor?" Derek asked again, louder this time, drawing the attention of a nurse walking past. "I am the doctor for this bay until Dr. Grant arrives," Laura answered, still focused entirely on Ethan, who was breathing hard through clenched teeth. "And right now, every second you spend arguing with me is a second he loses." The sting in her words landed, but Derek did not back down easily. He was a team leader, a man who had led operations across the world, and something about being challenged by someone so unassuming grated on him. "Just get it done," he muttered, stepping back to let her work, though his eyes stayed locked on her every movement, searching for a mistake, waiting for her to falter. Laura called for a suture kit and began cleaning the wound with quick, precise motions. Her hands did not shake. Her breathing did not change. If anything, the chaos around her seemed to sharpen her focus rather than rattle it. Another nurse, a younger woman named Megan Ellis, hurried over to assist, handing Laura instruments before she even asked for them, as if they had worked together for years, though in truth, they had only been colleagues for a few months. "You are doing fine," Megan whispered to Laura, sensing the tension radiating from the men standing nearby. "I know," Laura replied quietly, without looking up. Connor Blake, the 4th man in the group, leaned against the wall with his arms crossed, watching the scene unfold, with a smirk that did nothing to hide his doubt. "This is what passes for trauma care around here. A 5'0" nurse in a hallway?" Megan shot him a sharp look, but Laura remained unaffected, her focus entirely on the wound in front of her, examining it with the precision of someone assessing far more than what the naked eye could see. "The bleeding is deeper than it looks," Laura said, glancing briefly at the monitor. "He may have injured something on the way down. I need imaging, now." "Injured something?" Tyler repeated, his voice rising with impatience. "He fell off a ledge during a training exercise. There is a broken bone in his leg. You do not need imaging to see that." There is more happening beneath the surface than what you can see, Laura answered evenly, her tone calm but firm, carrying an authority that did not match her size or her soft voice. Trust me, or do not, but let me work. Derek studied her closely, noticing details he would not normally pay attention to. The way she held the scissors, the way she checked Ethan's pupils without being asked, the way her eyes flicked toward the door every few seconds, almost like she was watching for something, or someone. It was a habit he recognized because he did it himself, every single day of his life. He shook the thought away. It was nothing, just a coincidence born of exhaustion and worry for his teammate. "How long have you been a nurse?" Derek asked, his tone still edged with doubt, though something in his voice had softened slightly. "Long enough," Laura said simply, focused on stabilizing Ethan's leg with a splint before the doctor arrived. "Long enough to know panic never helps a patient. Long enough to know the loudest person in the room is rarely the one who saves a life." The comment landed like a quiet challenge, and Tyler's jaw tightened, though he said nothing further. Connor exchanged a glance with Derek, a silent question passing between them, though neither could put their finger on why the woman's calm demeanor unsettled them more than her size did. Ethan groaned again, his hand gripping the edge of the stretcher. "It hurts," he muttered through clenched teeth. "I know," Laura said gently, her tone shifting instantly, softer now, reassuring. "I am not going to let anything happen to you. Just breathe with me, in through your nose, slow, and out through your mouth." To the surprise of the men standing nearby, Ethan actually listened, his breathing gradually falling into rhythm with her instructions, the tension in his shoulders easing just slightly. It was a small moment, but it did not go unnoticed by Derek, who watched with a flicker of something unfamiliar. Respect, perhaps, though he was not ready to admit it yet. A doctor finally rushed in, out of breath, his white coat flapping as he moved quickly toward the stretcher. "What do we have?" he asked, his eyes scanning the scene. "Compound fracture, right shin bone, possible internal bleeding near the wound site," Laura reported instantly, her voice crisp and clinical, rattling off vitals and observations with a precision that made the doctor's eyebrows lift slightly in surprise. "Good work," the doctor said, nodding at her, before turning his full attention to Ethan. Derek watched the exchange closely, and for the first time since arriving, a small crack appeared in his certainty. Maybe she was not just some small-town nurse playing pretend. Maybe there was more to her than the uniform and the calm voice suggested, but he pushed the thought aside quickly, unwilling to give it more weight than it deserved. As the medical team wheeled Ethan toward imaging, Laura followed closely, monitoring his vitals, her hand resting briefly on his shoulder in reassurance. Derek and the others trailed behind, their earlier confidence shaken just slightly, though none of them would admit it out loud. "She is good," Megan said quietly to Connor as they walked, unable to resist defending her colleague. "Better than good, actually. I have never seen anyone stay that calm under this kind of pressure." Connor said nothing, his eyes following Laura as she walked ahead of them, her posture straight, her steps controlled and purposeful, almost military in their precision, though he told himself it was simply his imagination working overtime after a stressful night. None of them yet realized how much they still did not know about the woman in front of them, or how quickly the balance of power in that hallway was about to shift. Inside the imaging room, Laura stood beside the scanner, watching the screen with sharp focus as the images loaded one by one. The radiologist, a quiet man named Peter Wallace, glanced at her out of the corner of his eye, noting how quickly she read the scans before he had even finished speaking his findings aloud. "There is a small fracture near the knee joint that was not visible before," Peter said, pointing at the screen. "It could complicate his recovery if we do not address it properly." "I saw that," Laura said, nodding, her eyes still fixed on the image. "We need to stabilize it before he is moved again. Any sudden shift, and it could shift further." Peter raised an eyebrow slightly, impressed by how quickly she had spotted something that many trained professionals sometimes missed under pressure. "You have a good eye." "I have seen worse," Laura replied simply, already stepping back toward the hallway where Derek and his team waited. Outside the room, Derek paced back and forth, his arms crossed tightly over his chest, his frustration barely contained. Tyler sat in a plastic chair nearby, his leg bouncing with restless energy, while Connor leaned against the wall, scrolling through his phone without really seeing anything on the screen. "This is taking too long," Derek muttered, more to himself than to anyone else. "She seemed to know what she was doing," Connor offered, though his tone remained guarded, unwilling to fully commit to the compliment. "She got lucky," Tyler said dismissively. "Any nurse can slap a bandage on and call it treatment." Derek said nothing, though privately he was no longer as certain of that claim as he had been 20 minutes earlier. There had been something in the way Laura moved, something disciplined and unshaken, that reminded him uncomfortably of people he had served with, people who had faced situations far more dangerous than a hospital hallway and never lost their composure. When Laura finally emerged from the imaging room, her expression remained calm, though there was a new sharpness in her eyes, the kind that came from spotting a problem others might have missed. "There is a small fracture we need to address immediately," she said, addressing Derek directly. "It is treatable, but only if we act quickly and carefully. I need you and your team to stay calm and let us do our jobs." Derek studied her for a long moment, his earlier arrogance faltering slightly under the steady weight of her gaze. There was something about her that refused to be intimidated, something that made him question every assumption he had made since walking through those doors less than an hour ago. "Fine," he said finally, his voice quieter than before. "Do what you need to do." Laura nodded once, already turning to prepare for the next steps, unaware that the true test of her composure, and the secret she had carried quietly for years, was only about to begin. Back in the trauma bay, Ethan lay on the bed with his leg now stabilized in a temporary brace, his breathing steadier than before, though his face still carried the strain of pain he refused to voice too loudly in front of his teammates. Laura moved around him with quiet efficiency, checking his vitals every few minutes, adjusting the intravenous line, and speaking to him in a calm voice that seemed to settle the room each time she used it. "You are doing better than you think," she told him gently, checking the monitor above his bed. "The worst of it is behind you now." Ethan managed a weak smile. "You sound very sure of that." "I am," Laura said simply. "I have seen worse injuries heal just fine with the right care." Derek, who had taken a seat nearby, watched this exchange closely, his earlier hostility slowly giving way to something more complicated. He noticed how Ethan, a man who rarely trusted anyone outside his own team, seemed to relax around her almost instantly, as if some part of him recognized something in her that the others had not yet placed. "How did you end up working here?" Derek asked suddenly, breaking the quiet that had settled over the room. "A place this small does not usually attract someone with your kind of skill." Laura glanced at him briefly before returning her attention to the monitor. "Small towns need good care too, maybe more than the big cities do, since there is nowhere else for people to go when something goes wrong." "That is not really an answer," Derek said, his eyes narrowing slightly. "It is the only one you are getting right now," Laura replied, her tone light but firm, closing the subject without a hint of hesitation. Tyler, who had been quiet for the last several minutes, suddenly spoke up from the corner of the room. "You handle pressure like someone who has been shot at before. No offense, but that is not normal for a small-town nurse." The room went briefly still, the comment hanging in the air longer than intended. Laura did not answer immediately, her hands continuing their steady work, though something in her posture shifted, almost imperceptibly, like a door quietly closing before anyone could see what lay behind it. "Everyone reacts to pressure differently," she said finally, her voice even. "I choose to stay calm because panic never helped anyone survive anything." Connor, still leaning against the wall, tilted his head slightly, studying her with newfound curiosity, rather than the dismissive skepticism from earlier. "You said that phrase before too. Panic never helps. That is almost word for word something we get taught." Laura's hands paused for the briefest moment, so brief that only someone watching closely would have caught it, before she resumed her work as if nothing had happened. "It is common sense," she said simply. "I imagine a lot of people say the same thing without ever training for it." The room fell into an uneasy quiet again, broken only by the steady beeping of the heart monitor and the occasional shuffle of feet in the hallway outside. Megan Ellis entered a few minutes later, carrying a tray of supplies, and immediately sensed the strange tension hanging in the air. "Everything all right in here?" she asked carefully, glancing between Laura and the four men watching her. "Everything is fine," Laura said smoothly, taking the tray from her with practiced ease. "Just finishing up here." Megan lingered for a moment longer than necessary before excusing herself, though her eyes lingered on Laura with a flicker of quiet concern, as if she too sensed something building beneath the surface that had not yet fully revealed itself. Derek stood and walked closer to the bed, watching Laura work with an intensity that made her pause and finally meet his gaze directly. For a long moment, neither of them spoke, the silence stretching between them like a held breath. "Who are you?" Derek asked quietly, his voice stripped of its earlier arrogance, replaced instead with something closer to genuine curiosity. "I am the nurse, taking care of your friend," Laura answered evenly. "That is all you need to know right now." "That is not what I am asking," Derek said, his eyes narrowing as he studied her face, searching for something he could not quite name. "I have led men through situations that would break most people, and I know what discipline looks like when I see it. You have it, the kind that does not come from a nursing textbook." Laura held his gaze steadily, refusing to look away, though something behind her eyes flickered briefly, like a memory surfacing before being pushed back down. "Discipline can come from many places, Mr. Coleman. Not everyone with training wears a uniform for the rest of their life." The use of his last name, which he had not mentioned to her, caught Derek completely off guard. He was certain he had not introduced himself by his surname to anyone in the building, not even to the front desk when they arrived in a rush. "How do you know my name?" he asked slowly, his voice quieter now, edged with something between suspicion and disbelief. Laura's expression remained calm, though a faint, knowing look crossed her face, gone as quickly as it appeared. "It is on the intake form Megan filled out when you arrived." Nothing more mysterious than that. Derek glanced toward the door where Megan had exited moments earlier, uncertain whether to believe the explanation, though it was reasonable enough that he let the matter drop, at least for the moment. Still, something about the entire exchange left an unsettled feeling in his chest that refused to go away. Tyler, still watching from his chair, exchanged a look with Connor, both of them clearly rattled by the strange undercurrent running through the room, though neither could explain exactly why a simple nurse in a small hospital was making 4 trained operators feel so uneasy. Dr. Grant returned a short while later to check on Ethan's progress, his expression brightening slightly at the improvement in the young man's condition. "You did excellent work stabilizing him before I got here," he said to Laura, glancing over the charts she had prepared. "Your notes are extremely thorough, almost like a field report." The comment, casual as it was, landed heavily in the room, and Derek's eyes shot immediately to Laura's face, watching for any reaction. She simply smiled politely at the doctor, thanking him for the compliment, though her eyes flicked briefly toward Derek, as if daring him to say something more. He did not yet, though the question burned quietly at the back of his mind, refusing to fade. As the hours passed and Ethan's condition continued to stabilize, the atmosphere in the room slowly shifted from open hostility to something more watchful, more measured. The men who had walked in mocking her competence now found themselves studying her every movement, searching for clues, piecing together fragments of a puzzle they had not even realized existed an hour earlier. Connor, unable to contain his curiosity any longer, finally spoke up as Laura adjusted Ethan's bandage. "Where did you train?" he asked directly, his earlier dismissiveness completely gone, replaced by genuine interest. "Nursing school, like most people," Laura answered smoothly, not missing a beat in her work. "That is not what I mean," Connor pressed gently, "and I think you know that." Laura looked up at him then, her expression unreadable, though something behind her eyes seemed to weigh the question carefully before deciding how much, if anything, to reveal. "Some things are not meant to be discussed in a hospital hallway," she said quietly. "Maybe another time, if the moment calls for it." The vague answer only deepened the mystery surrounding her, and none of the men pressed further, though each of them carried the unanswered question with them as the night wore on, the tension in the room building slowly, quietly, like a storm gathering strength before finally breaking loose. Outside, the sky had darkened into evening, and the hospital settled into its usual quiet rhythm, broken only by the distant sound of ambulances arriving and departing. Inside the trauma bay, however, something far less visible was building, a slow unraveling of assumptions that would soon collide with a moment none of them could have predicted. Megan returned once more to check on supplies, catching Laura alone for a brief moment near the supply cabinet. "You seem different tonight," she said quietly, careful not to be overheard. "More guarded than usual." Laura offered a small, tired smile. "It has been a long night." "That is not what I mean," Megan said gently, echoing Connor's earlier words without realizing it. "You looked at that leader like you knew him from somewhere. Do you?" Laura's smile faded slightly, replaced by something more thoughtful, more distant. "I have met a lot of people over the years, Megan. Sometimes faces feel familiar even when they are not." Megan studied her friend carefully, sensing there was more beneath the surface than Laura was willing to share, but she nodded slowly, respecting the unspoken boundary Laura had drawn. "All right, just be careful. Something about tonight feels different." Laura nodded once, more to herself than to Megan, before turning back toward the trauma bay where Ethan rested, and where 4 men waited, watching, wondering, and slowly beginning to suspect that the woman they had mocked less than 2 hours earlier carried a story far larger than any of them had imagined. As the night stretched on, an unexpected complication began to surface, one that would push everyone in that room past the edge of their composure and force Laura to reveal far more than she had ever intended to share. Ethan's monitor let out a sharp, unfamiliar beep, and his body tensed suddenly on the bed, his breathing growing shallow and erratic. Laura's head snapped up instantly, her calm demeanor sharpening into something far more focused, far more urgent. "Something is wrong," she said, her voice steady but firm, already moving toward him with practiced speed. "Get Dr. Grant back in here, now." The room, which had settled into a watchful quiet only moments earlier, exploded into motion once again, the fragile calm shattering in an instant as the true test of the night finally began. Derek shot to his feet immediately, his earlier doubts about Laura forgotten in the sudden rush of fear for his teammate. "What is happening to him?" he demanded, his voice sharp with alarm as he moved closer to the bed. "His blood pressure is dropping fast," Laura said, her eyes fixed on the monitor as numbers shifted rapidly across the screen. "There may be internal bleeding we did not catch on the first scan. I need everyone to step back and give me room." Tyler, usually the loudest of the group, stood frozen near the wall, his face pale as he watched Ethan's body tremble slightly on the bed, his breathing coming in short, ragged gasps. "Do something," he said, his voice cracking with a fear none of them had expected to hear from him. "I am doing something," Laura replied firmly, without looking away from her patient, her hands moving with practiced precision as she adjusted the intravenous line and reached for an oxygen mask. "But I need you all to stay calm and stay out of my way." Connor, usually composed under pressure, felt his own heart pounding as he watched the scene unfold. The earlier mockery from less than 2 hours ago, now feeling distant and foolish in the face of the very real danger threatening one of their own. "Where is the doctor?" he asked urgently, glancing toward the door. "On his way," Megan answered, having rushed back into the room the moment the alarm sounded. She positioned herself beside Laura instantly, anticipating her next request, before it was even voiced, handing her a fresh set of gloves and preparing additional supplies with practiced speed. Laura placed the oxygen mask carefully over Ethan's face, her voice dropping into a low, steady murmur meant only for him. "Stay with me. Focus on my voice and keep breathing. You are not going anywhere tonight." Ethan's eyes fluttered weakly, his hand twitching slightly, as if trying to reach for something, though his strength seemed to be fading with each passing second. Derek watched helplessly from a few feet away, his fists clenched so tightly his knuckles turned white, the sight of his teammates struggling triggering memories of other moments he had tried hard to forget, moments where the outcome had not always been good. "Please," Derek said quietly, his voice breaking slightly, all traces of his earlier arrogance completely stripped away. "Please, do not let him die." Laura glanced up at him briefly, her expression softening for just a moment, before returning to the urgent task in front of her. "I am not planning on it," she said, her voice steady despite the chaos surrounding her. "But I need you to trust me completely right now. No hesitation, no questions, just trust." Derek nodded quickly, stepping back to give her space, though every instinct in his body screamed at him to do something, anything, to help the man he had fought alongside for years. Instead, he forced himself to stand still, watching Laura work with a focus and determination that reminded him painfully of moments from his own past he rarely allowed himself to think about. Dr. Grant burst into the room moments later, quickly assessing the situation as Laura relayed vital information with rapid precision. Internal bleeding near the fracture site, blood pressure dropping fast, respiratory rate increasing, she reported, her voice clear, despite the tension thick in the air. We need to move him into surgery immediately. Agreed, Dr. Grant said, already signaling for additional staff to prepare the operating room. Good catch, Laura. This could have been missed entirely if you had not flagged the deeper wound earlier. There was no time to dwell on the compliment as the room shifted into controlled motion, staff members moving with practiced coordination to prepare Ethan for emergency surgery. Laura remained close beside him the entire time, her hand resting briefly on his shoulder as they wheeled him toward the operating room, murmuring quiet reassurances that seemed to calm him even in his weakened state. Derek followed as far as the doors would allow, his heart pounding painfully in his chest as the medical team disappeared behind them, leaving him standing helplessly in the hallway with Tyler and Connor beside him, all three of them silent, shaken, and suddenly very aware of how quickly everything could change. He is going to be fine, Connor said, though his voice lacked its usual confidence, the words sounding more like a desperate hope than a certainty. Tyler said nothing, staring blankly at the closed doors, his earlier bravado completely gone, replaced by a quiet fear he rarely allowed himself to feel, let alone show. Derek turned away from the doors slowly, his mind racing back to the strange moments from earlier in the night, the way Laura had known his name without being told, the way she moved with a discipline that felt disturbingly familiar, the way Ethan had responded to her voice, as if some part of him recognized her on an instinctive level neither of them could explain. He sank into a chair in the waiting area, his elbows resting on his knees, his head lowered as exhaustion and worry finally caught up with him. Memories he had buried deep began resurfacing unbidden, memories of another mission years earlier, one that had gone wrong in ways he still refused to discuss with anyone, even his closest teammates. There had been a medic that day too, someone who had appeared out of nowhere during the worst moment of his life, someone whose face he had never clearly seen through the chaos and the pain, someone whose calm voice had guided him and his men through an impossible situation, using words and instructions that had felt strangely specific, almost coded, unlike anything he had heard from any other medical professional before or since. He had never learned that person's name. The operation had been classified, the details locked away in files he was not permitted to revisit, and the medic had vanished before he could properly thank them, disappearing into the night as quickly and quietly as they had appeared. For years, Derek had wondered about that mysterious figure, wondered if he would ever cross paths with them again, wondered if he would even recognize them if he did. Sitting in that hospital waiting room now, staring at the closed doors where his teammate fought for his life, a strange and unsettling thought began forming in the back of his mind, one he was not yet ready to fully acknowledge, though it refused to leave him alone. Connor sat down beside him, noticing the distant look on Derek's face. "You all right?" "I do not know," Derek admitted quietly, his voice barely above a whisper. "Something about tonight feels familiar, in a way I cannot explain." Tyler glanced over at them both, his earlier fear giving way to curiosity. "Familiar how?" Derek shook his head slowly, unwilling to voice the half-formed thought taking shape in his mind, unwilling to give it substance, until he had more than just a feeling to go on. "Never mind. Let us just wait and see how he does." The three men fell into a heavy silence, each lost in their own thoughts, the earlier confidence and mockery from when they had first arrived, feeling like a distant memory now, replaced by genuine worry and, in Derek's case, a growing suspicion that refused to be ignored no matter how hard he tried to push it aside. Inside the operating room, Laura worked alongside the surgical team with the same calm precision she had shown from the very beginning, her hands steady, her focus unshaken, her voice occasionally cutting through the tense atmosphere with quiet, clear instructions that seemed to settle the entire room each time she spoke. Dr. Grant, standing across from her, could not help but notice the quiet authority she carried, an authority that seemed entirely out of place for someone who claimed to be nothing more than a small hospital nurse. He said nothing, however, focused entirely on the delicate work in front of him, though the question lingered at the back of his mind as well. As the surgery progressed and Ethan's condition slowly began to stabilize, none of them yet knew that the true revelation of the night was still waiting just beyond the horizon, ready to surface the moment the crisis reached its peak. Nearly an hour into the surgery, the steady rhythm of the operating room shattered without warning. An alarm blared sharply as Ethan's heart rate spiked, then dropped, the numbers on the monitor swinging wildly as his body reacted violently to a complication no one had anticipated. "He is going into shock," one of the surgical nurses called out, panic edging into her voice as she scrambled to adjust the equipment surrounding the operating table. Dr. Grant's hands moved quickly, but even his experienced composure faltered slightly under the sudden chaos unfolding in front of him. "I need more suction here. Now," he barked, sweat beading on his forehead despite the cool temperature of the room. Laura stepped forward instantly, her earlier calm sharpening into something even more focused, more decisive. "His blood pressure is crashing. We are losing him," she said, her voice cutting through the rising panic with startling clarity. "What do you need?" Dr. Grant asked, glancing at her, his trust in her judgment now completely unquestioned after everything he had witnessed over the past hour. "Epinephrine. Immediately. And prep for a transfusion," Laura said, already moving to assist, her hands steady, despite the chaos exploding around her. "We do not have time to wait for the lab results. His pressure is falling too fast." The surgical team snapped into motion, but as they worked, Ethan's vitals continued to slide dangerously low, the alarm's shrill tone filling the room with a sense of mounting dread that pressed down on everyone present. For the first time that night, doubt flickered even across Laura's steady expression, though she pushed through it, refusing to let it slow her hands. Outside the operating room, Derek shot up from his chair the moment he heard the muffled commotion through the doors, his instincts screaming that something had gone terribly wrong. "What is happening in there?" he shouted, moving toward the doors despite Connor's attempt to hold him back. "You cannot go in there," a nearby nurse said firmly, stepping in front of him. "Please, sit down. The team is doing everything they can." "That is my teammate in there," Derek snapped, his voice raw with a desperation that silenced even Tyler, who had never seen their leader lose his composure so completely. "I need to know what is happening." The nurse hesitated, clearly torn between hospital protocol and the visible anguish in front of her, but before she could respond, the doors burst open and Megan rushed out, her face tense with urgency. "He is crashing," she said quickly, addressing Derek directly, since he was clearly the closest thing to next of kin available. "The team is doing everything possible, but I need you to stay calm and stay out here. Panicking will not help him." "Everything possible is not good enough," Derek said, his voice rising sharply, fear twisting into anger, the way it so often did in men unaccustomed to feeling helpless. "I want to know exactly what is being done for him right now." Megan opened her mouth to respond, but a sudden, sharp shift in the tone of the alarms coming from inside the operating room cut her off entirely. The sound sharpened into something more urgent, and through the small window in the door, Derek caught a glimpse of the surgical team moving with frantic, coordinated speed around the table. "No," he whispered, his hand pressing flat against the glass, his earlier arrogance completely gone, replaced by raw, unguarded fear. "No, not like this." Inside the room, the situation had reached its most critical point. Ethan's blood pressure continued to plummet despite the medication, his heart rate dangerously irregular, the surgical team working with a desperate intensity that filled the room with a suffocating tension none of them would soon forget. "We are losing the pressure," one of the nurses said, her voice tight with fear. "I do not think the transfusion is working fast enough." Dr. Grant's hands hesitated for the briefest moment, an almost imperceptible pause that in any other circumstance would have gone unnoticed, but in that critical instant carried enormous weight. It was the pause of a man suddenly uncertain of his next move, a rare and dangerous moment of doubt in the middle of a crisis that demanded absolute certainty. Laura saw it immediately. She had seen it before, in far more dangerous places than a small hospital operating room, moments where hesitation cost lives and confidence saved them. Without thinking, without weighing the consequences of what she was about to reveal, she stepped forward and spoke words that were not meant for a hospital at all. "Cardinal is down. Initiate Foxtrot recovery. Now," she said, her voice cutting through the chaos with a clarity and authority that silenced the entire room instantly. The words hung in the air, strange and out of place, yet carrying an unmistakable weight that made every trained instinct in the room snap into focus. Dr. Grant blinked, momentarily confused by the unfamiliar phrase, but something in Laura's tone left no room for hesitation, and his hands resumed their work immediately, following her lead without question. The surgical team, sensing the sudden shift in command, moved with renewed precision, executing the emergency protocol Laura outlined with rapid, clipped instructions that sounded less like hospital procedure and more like something from an entirely different world, a world of classified missions and split-second decisions where mistakes were measured in lives lost rather than complications logged. Outside the operating room, Derek froze completely, his hand still pressed against the glass, his eyes widening as the words drifted faintly through the door, muffled but unmistakable to ears trained specifically to recognize them. "Cardinal is down," he whispered, his voice trembling, the color draining from his face as memory and reality collided violently in his mind. "Foxtrot recovery." Connor, standing beside him, felt his blood run cold. "That is not possible," he said quietly, his voice barely audible. "That protocol is classified. It does not exist outside of our unit." Tyler stared at the door, his earlier mockery and doubt collapsing entirely under the weight of what he had just heard. "Who is in there?" he asked, though the question felt almost rhetorical, as if some part of him already suspected an answer too enormous to fully accept. Inside the operating room, the crisis reached its peak, and then, slowly, unbelievably, began to turn. Ethan's blood pressure steadied under the emergency protocol Laura had guided them through, his heart rate settling into a rhythm that, while still fragile, no longer teetered on the edge of collapse. The alarms quieted one by one, replaced by the steady, reassuring beep of a heartbeat holding firm. Dr. Grant exhaled a long, shaking breath, staring at Laura with an expression somewhere between disbelief and profound respect. "That protocol just saved his life," he said quietly, his voice still edged with the adrenaline of the last several minutes. "Where did you learn that?" Laura did not answer immediately, her eyes fixed on the monitor, watching Ethan's vitals settle into a stable rhythm before she finally allowed herself to exhale as well. The room around her remained silent, every member of the surgical team watching her with a mixture of awe and unspoken questions they were not yet sure how to voice. She had said too much. She knew it the moment the words left her mouth, knew that phrase belonged to a chapter of her life she had spent years carefully keeping hidden, tucked away behind the quiet routine of small-town nursing and ordinary days. But faced with the choice between silence and Ethan's life, there had been no real choice at all. Outside, Derek pushed past the nurse, who had tried to stop him earlier, bursting through the doors the moment they opened to allow the surgical team to wheel Ethan toward recovery. His eyes locked immediately on Laura, standing quietly beside the bed, her expression calm despite the storm clearly building behind his own eyes. "Say it again," he said, his voice low and shaking, though not with anger this time. "Say the phrase again." Laura met his gaze steadily, the calm mask she had worn all night finally beginning to crack under the weight of a moment she had known, somewhere deep down, might eventually arrive. "Derek," she said quietly, using his first name for the first time since he had arrived. "I think it is time we talked." The room around them fell utterly silent, every person present sensing that whatever came next would change everything they thought they understood about the small, unassuming nurse who had spent the entire night quietly proving them all wrong. Connor and Tyler crowded into the doorway behind Derek, their faces pale with a mixture of shock and disbelief, waiting for an explanation that felt both impossible and, somehow, entirely inevitable. "Who are you?" Derek asked again, his voice barely above a whisper this time, stripped of every trace of the arrogance he had carried into the hospital hours earlier. "Tell me the truth. All of it." Laura glanced around the room slowly, taking in the exhausted faces of the surgical team, the pale, shaken expressions of the three men standing in the doorway, and finally Ethan, resting peacefully now in the bed beside her, his chest rising and falling steadily for the first time in what felt like hours. She drew a slow, steadying breath, the kind she had not needed to take in years, and began to speak. "Not here," she said quietly, glancing at the surgical team still finishing their work around Ethan's bed. "He needs rest, and this is not the place for this conversation." Derek's jaw tightened, frustration flashing across his face at the delay, but something in Laura's steady gaze convinced him to hold his tongue, at least for the moment. "Where then?" he asked, his voice still tight with barely contained urgency. "There is a quiet room down the hall," Megan offered gently, stepping forward from where she had been watching the entire exchange with wide, disbelieving eyes. "Family members use it sometimes. It should be empty right now." Laura nodded once in gratitude, casting a final glance at Ethan, whose chest continued to rise and fall in a steady, reassuring rhythm, before turning to lead the three men down the hallway. Dr. Grant remained behind with the surgical team, though his eyes followed Laura's retreating figure with an expression of quiet astonishment, the earlier crisis replaced now by a different kind of disbelief entirely. The small room Megan had mentioned held a few worn chairs and a table with old magazines scattered across its surface, the kind of space designed to offer comfort during long, anxious waits. Laura closed the door quietly behind them, the click of the latch sounding unusually loud in the tense silence that had settled over the group. Derek stood near the center of the room, his arms crossed tightly, though the posture no longer carried the arrogance from earlier in the night. Instead, it looked more like a man bracing himself for news he was not certain he wanted to hear. Tyler leaned against the wall beside the door, his earlier bravado completely gone, replaced by wide-eyed uncertainty. Connor took a seat at the small table, his hands clasped together tightly, his eyes fixed on Laura with an intensity that bordered on desperation. "That phrase," Derek said finally, breaking the silence that had stretched between them since entering the room. "Cardinal is down. Foxtrot recovery. That is not something you learn in a hospital. That is not something you learn anywhere, unless you were part of something classified." Laura remained standing near the door, her posture calm but guarded, the years of careful discretion warring visibly with the sudden pressure to finally speak the truth aloud. "You are right," she said quietly. "It is not something taught in any hospital." "Then where?" Connor pressed, leaning forward slightly in his seat. "Where did you learn it?" Laura's eyes drifted briefly toward the small window in the room, her gaze distant for a moment, as though looking through it into a memory none of them could see. "A long time ago in a place very far from here, I was part of a team that specialized in exactly the kind of situation your friend faced tonight," she said slowly, choosing each word with careful precision. "We operated in conditions most people never have to imagine, supporting units that could not afford the luxury of waiting for conventional medical response." Tyler's breath caught audibly, his earlier mockery from hours before suddenly feeling like a distant, foolish memory. "You mean you were—" He trailed off, unable to finish the sentence, the implication too large to voice aloud. "I was a combat medic," Laura said simply, the words landing with quiet, undeniable weight. "Attached to a classified support unit, the kind of unit whose records do not officially exist in any public database, and whose operations are never discussed outside of very specific circles." Derek's face had gone pale, his mind racing back through years of buried memory, piecing together fragments of a night he had spent years trying not to think about. "The extraction," he said quietly, almost to himself. 3 years ago, the compound. Everything went wrong, and then somehow, everything did not. Laura's eyes met his directly for the first time since entering the small room, something unspoken passing between them, an understanding neither of them had expected to ever share. "Yes," she said softly, "I remember that night too." The room fell into stunned silence, the weight of the revelation settling over all three men like a physical force. Connor's hands trembled slightly as he processed the implications, while Tyler simply stared at Laura with an expression caught somewhere between disbelief and dawning realization. "You were there," Derek said, his voice barely above a whisper, the words carrying the disbelief of a man finally confronting a mystery he had carried unresolved for years. "You were the medic who pulled us out that night, the one none of us ever saw clearly, the one who vanished before we could even learn a name." Laura nodded slowly, the calm composure she had maintained all night finally softening into something more vulnerable, more human. I was there, she confirmed quietly, and I have carried that night with me every single day since, wondering if the men I helped that time ever made it home safely. Derek took a step closer. His earlier arrogance and doubt completely dissolved, replaced by something raw and unguarded, an emotion none of his teammates had ever witnessed from their normally composed leader. "We made it home because of you," he said, his voice thick with emotion he no longer bothered to hide. "All of us. Because of a medic we never got the chance to properly thank." The quiet room seemed to hold its breath, the full weight of the revelation settling over everyone present, transforming the mockery and doubt of just a few hours earlier into something far more complicated, far more profound, than any of them could have anticipated when they first burst through the hospital doors that night. Connor finally broke the heavy silence, his voice quieter now, stripped of its earlier condescension. "Why did you leave? Someone with your skills, your experience. Why walk away from all of that to work in a small hospital most people have never even heard of?" Laura moved slowly toward one of the empty chairs and sat down, her earlier composure giving way to something more tired, more honest. "After that extraction, things changed for me," she said, her eyes fixed on her hands folded in her lap. "The unit I served with lost 2 people that night. Good people, people I had trained alongside for years. I made it out. They did not. And no amount of skill or discipline changes the fact that some nights, the outcome depends on things far beyond anyone's control." Tyler lowered himself slowly into the chair across from her, his earlier bravado replaced entirely by quiet respect. "You blamed yourself," he said softly, not quite a question. "For a long time, yes," Laura admitted. "I kept replaying that night over and over, wondering what I could have done differently, wondering if there had been some other choice that might have saved everyone instead of most of them. It took me a long time to understand that some nights, you save who you can, and you carry the weight of who you could not for the rest of your life." Derek sat down heavily in the remaining chair, his eyes never leaving her face, the years of unresolved questions finally beginning to find answers he had never expected to receive. "I did not know their names," he said quietly. "The 2 we lost that night. I only knew their call signs. Falcon and Wren." Laura's composure cracked slightly at the mention of the names, her eyes glistening briefly before she blinked the emotion away, drawing on years of practiced control. "Falcon was my closest friend," she said, her voice thinner now, carrying a grief that had clearly never fully healed. "We trained together for 3 years before that mission. He had a daughter back home he talked about constantly, showed everyone pictures whenever he got the chance." The room fell silent again, the weight of shared loss settling over all of them in a way that erased whatever distance had existed between them just hours earlier. Derek remembered fragments of that night now with painful clarity, remembered a voice calling out call signs and instructions with a calm precision that had somehow held their entire fractured team together during the worst hours of their lives. "Wren," Derek said suddenly, his eyes widening slightly as another piece of the puzzle clicked into place. "That was your call sign, wasn't it?" Laura looked up at him, and for the first time all night, something like a genuine small smile crossed her face, tired, but real. "It was," she confirmed quietly. "Not many people ever learned that name. It feels strange hearing it spoken out loud after all this time." "You never told anyone what happened that night," Connor said, piecing together the fuller picture forming in his mind. "Not even after you left the unit." "The details were classified," Laura said simply. "And even if they were not, some things are not meant to be spoken about casually. I built a quiet life here, in a place where nobody expected me to be anything other than an ordinary nurse. It was not running away exactly. It was more like finally allowing myself to exist without constantly looking over my shoulder." Tyler leaned forward, his earlier mockery feeling like a distant memory from another lifetime entirely. "We made fun of you the moment we walked in," he said, his voice heavy with genuine regret. "We assumed you would not know what you were doing. We could not have been more wrong." Laura offered him a small, understanding smile, free of any lingering resentment. "People make assumptions based on what they can see," she said gently. "Most people never look past a small stature or a soft voice to consider what might actually lie underneath. I stopped taking it personally a long time ago. It is simply how most first impressions work." Derek shook his head slowly, guilt visible in every line of his expression. That does not make it right, he said firmly. We should have known better. We of all people should have understood that appearances rarely tell the whole story. You were scared for your friend, Laura said gently, her tone carrying no trace of blame. Fear makes people say things they might not otherwise say. I understand that better than most. The room settled into a quieter, more reflective silence, the earlier tension finally beginning to dissolve into something resembling mutual respect and, tentatively, the beginnings of trust. Connor glanced toward the door, his mind still processing everything he had just learned. Does anyone else know about this? About who you really are? A few people, over the years, Laura said. Dr. Grant does not know the specifics, only that I have some background that occasionally proves useful in emergencies. Megan suspects there is more to my past than I have shared, though she has never pressed for details, which I am grateful for. What about your family? Tyler asked quietly, an unexpected softness entering his voice. Do they know? Laura's expression grew distant again, though not with grief this time, something closer to quiet acceptance. My parents know I served, though not the specifics of what that service involved. They stopped asking questions a long time ago, once they realized I would not be able to answer most of them honestly. Derek studied her closely, a new understanding forming behind his eyes, one built not on assumption or arrogance but on genuine respect, earned through hours of witnessing her skill, and, now, understanding the depth of experience behind it. Ethan is alive because of you, he said quietly. Twice now, apparently, though he will only ever remember tonight. He is alive because an entire team worked together to save him, Laura corrected gently. I simply provided one piece of a much larger effort. Dr. Grant and his team deserve just as much credit. You are being modest, Connor said, a small, genuine smile finally breaking through his earlier shock, which, given everything we now know about you, is honestly a little ridiculous. A soft, unexpected laugh escaped Laura, the first genuine moment of levity the room had experienced all night. Perhaps a little, she admitted. Old habits, I suppose. Staying quiet and letting the work speak for itself became second nature a long time ago. Derek leaned forward, his earlier arrogance completely replaced by something humbler, more sincere. I owe you an apology, he said, his voice steady and clear, despite the emotion still visible in his eyes. Not just for tonight, though certainly for that too, but for 3 years ago as well. I never got the chance to properly thank the person who saved my team that night. I did not even know if you were still alive, let alone if I would ever have the chance to say it directly. Laura met his gaze steadily, something in her posture softening in a way none of them had witnessed since the chaotic moment they first arrived. Thank you, she said quietly, the words simple but carrying enormous weight after years of unspoken gratitude, finally finding its way to the surface. You do not know how much it means hearing that your team made it home safely. I have wondered about that for a very long time. All of us made it home because of you, Derek said firmly. Every single one of us. And I am ashamed it took nearly losing Ethan tonight for any of us to see who you really were from the very beginning. The quiet room, filled only hours earlier with mockery and doubt, now held something entirely different. A fragile but genuine connection, forged through shared history, mutual loss, and a respect that had been slow to arrive but felt, in that moment, unshakably real. Megan knocked softly on the door before stepping inside, her expression gentle as she addressed the group. Ethan is stable and resting comfortably. The surgical team says his recovery looks promising. He should wake up within the next hour or so, if any of you would like to be there when he does. Derek stood immediately, exhaustion and relief mixing visibly across his face. Yes, he said, we would like that very much. As the group rose to follow Megan back toward the recovery area, Derek paused at the door, turning back toward Laura one final time. Will you come with us? He asked. I think Ethan deserves to know the truth about the person who saved his life tonight, and years ago as well. Laura hesitated for a brief moment, years of careful discretion warring against a quiet, tentative desire to finally step out from behind the walls she had built so carefully around herself. Slowly she nodded. All right, she said softly. I think it might finally be time. They walked together down the quiet hallway, the four of them moving with a different energy than when they had first stormed through the hospital doors hours earlier. Tyler walked beside Laura now, his earlier restlessness replaced by a quiet, thoughtful curiosity. "Can I ask you something?" he said carefully. "Of course," Laura replied. "Do you ever miss it? The old life, I mean. The teams, the missions, all of it?" Laura considered the question for a long moment before answering. "Some parts, yes," she admitted honestly. "The sense of purpose, the bond between people who trust each other completely because their lives depend on it. That kind of connection is rare, and I miss it sometimes. But I do not miss the losses, or the constant weight of knowing that any mission could be someone's last. This life, quieter as it is, lets me help people without that particular kind of fear hanging over every decision." Connor listened closely, nodding slowly. "That makes sense," he said. "I think most of us understand that trade-off better than we let on." As they reached the recovery area, Dr. Grant met them near the entrance, his expression brightening at the sight of the group approaching together, the earlier tension between them clearly resolved. "He is doing remarkably well," the doctor said, glancing between Laura and the three men beside her. "Vitals are strong, and the surgical team is confident about a full recovery." "Thank you," Derek said sincerely, extending a hand toward the doctor, who shook it warmly. "Your friend has quite the team looking out for him," Dr. Grant added, glancing meaningfully at Laura, "and apparently quite the history as well." Laura offered a small, embarrassed smile, but said nothing further, content to let the moment pass without additional explanation. Dr. Grant, sensing her preference for privacy, simply nodded respectfully and led them toward Ethan's recovery room, where the steady beeping of monitors now carried a far more reassuring rhythm than it had just an hour earlier. Standing outside the door, Derek turned to Laura one last time before they entered. "Thank you," he said again, quieter this time, the words carrying the full weight of everything the night had revealed. "For tonight, and for 3 years ago. I do not think I will ever be able to properly repay that." "You already have," Laura said gently, "by making it home safely, and by bringing your teammate here tonight, instead of somewhere that might not have caught what we caught in time. That is more than enough." Derek nodded, swallowing hard against the emotion still thick in his throat, before finally pushing open the door and stepping inside, the others following close behind him, ready to see their teammate, and to begin the process of understanding just how much their perception of the small, unassuming nurse had changed in the span of a single, unforgettable night. Ethan lay in the recovery bed, his color much improved, the machines around him beeping steadily in a calm, reassuring rhythm. His eyes fluttered open slowly as the group entered, and a weak but genuine smile spread across his face when he saw his teammates gathered around him. "You all look worse than I feel," he said, his voice hoarse but laced with a hint of familiar humor. Tyler let out a relieved laugh, moving quickly to his bedside. "You scared the life out of all of us tonight." "Sorry about that," Ethan said, wincing slightly as he shifted in the bed. "Wasn't exactly planning on it." Derek stepped forward, placing a gentle hand on his teammate's shoulder, relief evident in every line of his face. "How are you feeling?" "Tired," Ethan admitted, "but alive, apparently, which I am told I should be grateful for." His eyes shifted toward Laura, standing quietly near the back of the group, and something in his expression softened with recognition, though the details remained hazy in his memory. "You were the one talking to me earlier, telling me to breathe." "That was me," Laura confirmed gently, stepping closer to the bed. "You also apparently saved my life twice, according to what I am hearing whispered outside this room," Ethan said, glancing between his teammates with a look of amused confusion. "Would somebody like to fill me in?" Derek exchanged a glance with Laura, silently asking permission before continuing. She gave a small, permitting nod, and Derek turned back to Ethan, his voice steady despite the weight of what he was about to share. 3 years ago, during the extraction that went wrong, there was a medic who guided us through the worst night of our lives. We never learned her name, never even saw her face clearly. Tonight, it turns out, she has been standing right in front of us the entire time. Ethan's eyes widened slightly, understanding dawning slowly across his tired features as he looked toward Laura with newfound appreciation. "You are kidding," he said quietly. "That was you?" "It was," Laura confirmed simply. Ethan shook his head slowly. a look of genuine awe crossing his face, despite his exhaustion. "I always wondered about that night," he said. "Wondered who it was that kept us together when everything else was falling apart. I never imagined I would actually get the chance to thank them in person." "You do not owe me any thanks," Laura said gently. "You and your team fought through that night with incredible courage. I simply did what I was trained to do." "Trained to do humbly, apparently," Connor added, a small smile finally breaking through the exhaustion on his own face. "She has been deflecting credit all night." Ethan chuckled softly, then winced again at the movement, prompting Laura to step forward and check his vitals once more with practiced, familiar care. "You should rest," she said gently. "Your body has been through a great deal tonight, and healing takes time." "I think I have earned a little rest," Ethan agreed, settling back against the pillows, though his eyes remained fixed on Laura with quiet gratitude. "Thank you," he added softly, "for tonight, and for whatever happened back then that none of us fully understood until now." Laura offered him a warm, genuine smile, free of the careful guardedness she had carried for most of the evening. "Get some sleep," she said simply. "We will be here when you wake up." The group settled into a quiet vigil around Ethan's bed as he drifted into a peaceful sleep, the earlier chaos of the night finally giving way to a calm, steady relief. Derek moved to stand beside Laura near the window, both of them watching the steady rise and fall of Ethan's chest in comfortable silence. "What happens now?" Derek asked quietly, glancing at her. "Does anyone else need to know about tonight, about what you revealed?" Laura considered the question carefully before answering. "Some details will remain private, out of necessity," she said. "But I think, after tonight, I no longer need to carry this particular secret entirely alone. It might be nice, actually, to let a few people finally know the whole truth." Derek nodded, understanding the weight behind her words far better than he might have just hours earlier. "For what it is worth, I am glad it was you tonight, and 3 years ago as well. I do not think any of us would be standing here otherwise." "I am glad too," Laura admitted quietly. "Some nights remind you why the work matters, even after everything it has cost." As the first hints of morning light began filtering through the hospital windows, the small group remained gathered around Ethan's bed, their earlier mockery and doubt now replaced entirely by a quiet, hard-earned respect. Megan appeared in the doorway sometime later, offering everyone a tired but warm smile. "Visiting hours technically ended a while ago," she said gently, "but given the circumstances, I think we can make an exception." "Thank you," Derek said sincerely, glancing at her, before turning his attention back to Laura, "for everything tonight." Megan smiled knowingly, having pieced together enough of the earlier conversation to understand at least part of what had transpired. "She has that effect on people," she said softly, glancing at Laura with quiet pride. "Underestimate her once, and you rarely make that mistake twice." The following days passed quietly, Ethan's recovery progressing steadily under the careful watch of the hospital staff, with Laura checking in on him regularly, their earlier professional relationship gradually deepening into something closer to genuine friendship. Derek, Tyler, and Connor visited often as well, their earlier arrogance replaced by a quiet, respectful gratitude that showed itself in small gestures rather than grand statements. One afternoon, as Ethan prepared for discharge, Derek approached Laura in the hallway, holding a small, wrapped package in his hands. "It is not much," he said, handing it to her somewhat awkwardly, "but the team wanted you to have this." Laura unwrapped it carefully, finding inside a small, carved wooden bird, delicately detailed, clearly crafted with care. "A wren," she said softly, tracing her fingers over the small carving, her eyes glistening slightly with emotion she rarely allowed herself to show. "Tyler made it," Derek explained. "Turns out he has a talent for woodworking when he is not busy making poor first impressions." Laura let out a soft, genuine laugh, cradling the small carving gently in her palms. "Tell him thank you," she said. "This means more than he probably realizes." "I think he understands," Derek said quietly. "We all do now." As the team prepared to leave the hospital that final time, Ethan walking slowly but steadily beside them, Derek paused once more beside Laura, extending his hand toward her in a gesture of genuine respect. "If you are ever in need of anything," he said, "anything at all, you know how to reach us now." I appreciate that, Laura said, shaking his hand firmly. But I think, for now, I am exactly where I am meant to be. Derek nodded, understanding completely, before turning to join his team as they made their way toward the exit, their earlier mockery from that first chaotic night feeling like a distant, almost unrecognizable memory now, replaced by a bond forged through shared history and mutual respect. Laura watched them go, the small wooden bird still cradled gently in her hand, before turning back toward the quiet rhythm of the hospital, ready to continue the work she had quietly dedicated her life to, no longer carrying her past entirely alone, but finally, gently, at peace with exactly who she was. Megan joined her a moment later, glancing at the small carving with a warm smile. "Looks like you made quite an impression," she said. "They made one on me too," Laura replied softly, slipping the small wooden bird into her pocket, before returning to the steady, quiet work of the ward, the secret she had carried for so long, finally feeling a little lighter, shared at last with those who truly understood its weight. Weeks passed, and the hospital slowly returned to its familiar rhythm, the late-night chaos of that particular evening fading into just another story among the many the staff carried with them through years of long shifts and quiet dedication. Laura continued her work exactly as before, arriving early, staying late when needed, treating every patient with the same calm, steady attention, regardless of who they were or what had brought them through the doors. Yet something had shifted subtly within her, a quiet lightness that had not been there before. She found herself smiling a little more easily, lingering a little longer in conversations with her colleagues, no longer holding quite as tightly to the careful walls she had built around her past. Megan noticed the change almost immediately, though she said little about it, simply grateful to see her friend carrying herself with a bit less weight on her shoulders. One quiet afternoon, several weeks after Ethan's discharge, a small package arrived at the hospital, addressed simply to Laura Bennett, ER. Megan brought it to her during a rare lull in the day's activity, curiosity evident on her face. "Another gift from your admirers," Megan teased gently, handing over the package. Laura opened it carefully, finding inside a handwritten letter along with a photograph. The letter, written in Ethan's familiar handwriting, expressed a simple, heartfelt gratitude for the second chance she had given him, along with news that he had returned to full health and was back to his usual routine. The photograph showed the entire team standing together outdoors, smiling, Ethan standing tall and clearly recovered among his teammates. Laura studied the photograph for a long moment, a warm smile spreading across her face as she took in the sight of the men who had once mocked her competence now standing together, healthy and whole, their earlier arrogance replaced by the easy camaraderie of people who had faced something difficult together and come out stronger for it. "Good news?" Megan asked, noticing the smile. "Very good news," Laura confirmed, carefully tucking the photograph and letter into a small drawer at her station, alongside the wooden bird Tyler had carved for her. A quiet collection of reminders that some of the hardest nights could still lead to unexpected connection and healing. Later that evening, as Laura prepared to leave for the day, Dr. Grant caught up with her near the exit, his expression thoughtful. "I never got the full story," he said gently, "and I do not need it if you would rather keep it private. But I wanted you to know how much that night changed the way I think about the people I work alongside every day. You reminded all of us that experience and skill can come from the most unexpected places." Laura smiled warmly at him, appreciating the sentiment without needing to elaborate further. "Thank you, Dr. Grant. That means a great deal. Whatever your story is," he added, "this hospital is lucky to have you." Laura nodded, a quiet, genuine gratitude settling over her as she stepped outside into the cool evening air, the sky painted with the soft colors of a setting sun. She walked slowly toward her car, reflecting on how strange and unexpected life could be, how a single chaotic night could unravel years of carefully guarded silence, and somehow leave her feeling more at peace rather than more exposed. She thought of Falcon, her old friend, gone now for 3 years but remembered clearly in the quiet moments when the world slowed down enough to allow the memory space to breathe. She thought of the team she had once served alongside, scattered now across different lives, some still serving, others like her having found quieter paths forward. And she thought of Derek, Tyler, Connor, and Ethan, the men who had walked into her emergency room with arrogance and doubt, and walked out with a respect and gratitude that had reshaped something quietly broken inside all of them. As she drove home through the familiar streets of the small town she had chosen as her refuge, Laura allowed herself a rare moment of genuine contentment. She had built a quiet life here, one defined by service rather than recognition, by steady dedication rather than grand gestures. And though that chaotic night had cracked open a door to her past she had kept firmly closed for years, she found that the world on the other side of that door was not nearly as frightening as she had once feared. Some secrets, she realized, were never meant to be carried entirely alone forever. Sometimes, the right moment simply had to arrive, however unexpectedly, to remind a person that strength was not measured by how much weight someone could carry in silence, but by how honestly they could finally choose to set a portion of that weight down, trusting that those around them would understand its significance. Back at the hospital, the small wooden bird remained tucked carefully in its drawer, a quiet symbol of a night that had begun with mockery and doubt, and ended with an unexpected, hard-earned understanding between strangers who had, without realizing it, already shared far more history than any of them could have imagined when the emergency room doors first burst open. And somewhere in a small town that most people would never think twice about, an unassuming nurse continued her quiet work each day, carrying herself with the same calm, steady confidence as always, no longer entirely hidden behind the walls of her past, but finally, gently, at peace with every part of the story that had shaped her into exactly who she was.